Hello, and welcome to the Joint Commission Resources Quality and Safety Network Accreditation Update. I'm your host, Jamie Marvin. In any healthcare organization, leadership's first priority is to be accountable for effective care while protecting the safety of patients, employees, and visitors. The Joint Commission's Sentinel event database reveals that leadership's failure to create an effective safety culture is a contributing factor to many types of adverse events, from wrong site surgery to delays in treatment. Inadequate leadership can contribute to adverse events in various ways, including, but not limited to, insufficient support of patient safety event reporting, lack of feedback or response to staff and others who report safety vulnerabilities, allowing intimidation of staff who report events, refusing to consistently prioritize and implement safety recommendations, and not addressing staff burnout. The recently released Joint Commission Sentinel Event Alert, Issue 57, emphasizes that the health of an organization's safety culture is determined by leadership's commitment to making it a priority. The Joint Commission recommends that leaders take actions to establish and continuously improve the 5 components of a safety culture. These components are trust, accountability, identifying unsafe conditions, strengthening systems, and assessment. Leaders will need to address and apply various components to the workforce simultaneously, using tactics such as board engagement, leadership education, goal setting, staff support, dashboards, and reports that routinely review safety data. Note that the following Joint Commission recommended actions are not intended to be implemented in a sequential manner. First, it's absolutely critical that a transparent, non-punitive approach to reporting and learning from adverse events, close calls, and unsafe conditions is in place. Leaders must be sure to develop trust and accountability through an organization-wide and easy-to-use reporting system. This reporting system should be accessible to everyone within the organization. Leaders must establish clear, just, and transparent risk-based processes for recognizing and separating human error and error arising as a result of poorly designed systems from unsafe or reckless actions that are blameworthy. To advance trust within the organization, all leaders must adopt and model appropriate behaviors and champion efforts to eradicate intimidating behaviors. Leaders must establish, enforce, and communicate to all team members the policies that support safety culture and the reporting of adverse events, close calls, and unsafe conditions. Leaders must recognize care team members who report adverse events and close calls, who identify unsafe conditions, or who have good suggestions for safety improvements. Leaders must establish an organizational baseline measure on safety culture performances using tools such as the Agency for Healthcare's research and Quality's Hospital Survey on Patient Safety Culture, or the Safety Attitudes Questionnaire. Leaders must also analyze safety culture survey results from across the organization to find opportunities for quality and safety improvement. In response to information gained from safety assessments and/or surveys, leaders must develop and implement unit-based quality and safety improvement initiatives designed to improve the culture of safety. Leaders must embed safety culture team training into quality improvement projects and organizational processes to strengthen safety systems, proactively assess strengths and vulnerabilities, and prioritize them for enhancement or improvement. And finally, leaders must repeat organizational assessment of safety culture every 18 to 24 months to review progress and sustain improvement. For more information on this Sentinel Event Alert, as well as other topics, please visit the Joint Commission website at jointcommission.org/Sentinel_event. Now stay tuned for today's JCR QSN program.